So we're getting some feedback from our audience here.
Okay, we've got a lot of questions here from the gallery here. Number one is there a mobile interface? Could you have a desktop computer-based speaker interacting with multiple desktop and mobile listeners, like a virtual grand rounds or patient education sessions?
Oh, great questions.
Yes, indeed. We see video technology emerging and evolving to include things like wireless and 3G and emerging 4G components. We see multi-point conferences that will consist of medical universities on perhaps auditorium type systems. It will consist of smaller remote facilities on maybe desktop systems. It will consist of individual users and medical professionals logging in, let's say, on their laptop from home. So those multi-party grand rounds, tumor board type environments are becoming standard practice these days.
So that wouldn't be in the current version you have now. That would be something in a future version, would you say? That's kind of what I'm hearing you say.
Well, as networks evolve, broadband becomes more distributed. Wireless becomes a little more able to deal with the high bandwidth requirements of video conferencing, of interactive video conferencing. We see the world emerging. It's a little bit to do with the technology that exists today out in the cloud computing, and a little bit to do with the processing. We see that process emerging, and in fact are and can do wireless video conferencing today.
Great. Other feedback? Great.
Absolutely. KOV, Nakov, I guess, in the chat room is asking, is the quality of the video good enough for diagnosis? So rashes, lacerations, that kind of stuff.
Yes, we really see two components as being essential. Real-time interaction will include smooth motion handling. It will also include things that are benchmarks for medical professionals. Color rendition of rash lesions, things along those lines are extremely important. So the video conferencing, the telemedicine solutions do have the ability to hook up things like high magnification specialty cameras, as well as digital type point and shoot cameras, to be able to show the magnification levels required to properly assess a particular lesion, skin lesion, rash.
You don't happen to know, I guess a techie question would be some of the resolution settings and things of the video conferencing system?
Well, we certainly deal in current standards from the XGA standpoint, from the 256 bits, from the resolution standpoint, in color rendition. An awful lot has to do with the camera at the transmit side, as we all will understand. But motion handling, generally speaking, authentication, security are all issues that have been addressed by medical professionals. And as an example, our website has some great case studies on folks using telemedicine video conferencing quite effectively to deliver ultrasound images, to deliver critical care assessments for stroke patients, to deliver assessments in school-based medicine, again, where those children present the rash, the lesion, the earache. We see telemedicine as an enabling mechanism to really deliver health care to where health care resides, to where you and I live and work.
Great.
Yep, we've got a few more questions, and then we're going to have to wrap up because we're running late. You know how doctors are. So HIMSS Vista here is asking if can part of video interaction be saved as a part of the patient record?
An excellent question. And we have technology designed that will record video sessions, that will encapsulate, allow for editing and auditing. And yes, there are some electronic medical records, that are adapting to allow the storage of static imaging as well as real-time interactive streams.
Great. And maybe one more question?
Do we need proprietary hardware for the technology to work?
the standards are based in video algorithms. Again, not to get too technical, but on the IP side, it's standard 323 encoding and decoding. So yes, there are proprietary systems. Tandberg is proud to say that we are a universal system. We work within all telecommunication standards across our product line. So again, we see the ability to bring in multiple manufacturers and modalities under a standards compliance umbrella to be essential in the smart development of telehealth.
Great. And last question here. For people who are on site here, where can they find you? And people who aren't able to be here, where can they find you on the internet?
Well, thank you very much. Starting backwards, we are at www.tandberg.com. That's TANDBERG.com. We are proud to be represented here by a number of partners, one being Verizon here in the C Hall, and a couple of partners in the A Hall. So look for Tandberg under many of our partners.
Great, great. So George Diorio from Tandberg, thank you so much for the time. I appreciate it.
Thank you. Thank you both.
Great. And we'll be right back. Yes.